Good afternoon, ladies and gentlemen, and thank you very much for your kind introduction. I'm Keizo Takemi. Professor Kanye has spent the past 3 years working on a project on SDGs. While engaged in preparations of SDGs, how Japan is to come up with a system to address challenges in achieving SDGs. These topics have been covered by Professor Kanye. From my part, I would like to focus on health and medical services issues. How these relate to SDGs is something that I would like to report to you. SDG is a follow-up to the MDGs. Under the leadership of Kofi Annan in 2000, in putting together MDGs, the new global targets had less of a significance. I mean, people had lack of understanding as to the importance of these goals. So this mechanism that we currently have was lacking, and under the leadership of Kofi Annan, advisory committees, a couple of advisory committees were established, and their reports were submitted to the General Assembly, where unanimous adoption of MDGs was realized. But in the following 15 years, in the ensuing 15 years, MDGs have evolved into targets in financing. And when stakeholders try to raise funds, achieving MDGs could be of great help. This came to be realized by many. So in establishing SDGs, stakeholders were keen to protect and defend their positions. And that is one of the reasons why many stakeholders were engaged in the process of setting SDGs. Open panel was established, and this process of putting together SDGs was driven by the engagement of many stakeholders. But what is important is that not just developed countries, but developing countries as well. This is the comprehensive set of targets for the global challenges that we face. It is true that we have 17 targets, and we have 169 targets. You may say that it is hard to know where the priority should be placed. It is the reaction of many in the aftermath of the SDGs. But we have to think of why we have these SDGs goals. And we need to think about the significance of these goals and targets for the human society. These goals and targets are for the purpose of achieving coexistence between people and the Earth. This is a way to explore measures to achieve a symbiosis or coexistence. And as was mentioned by Professor Kanye, how to implement and achieve these goals. We need to design governance and systems and institutions. And these are some of the elements already in the goals. And that's goals 16 and 17. The final two goals are on institution building and designing of systems to implement and achieve these goals. That, I believe, is quite significant. So let me first of all focus on the issue of health. In addressing health-related challenges, what are the basic principles for Japan? Japan has always been an advocate of the notion of human security. And Japan has always been a proponent of the notion human security. And the series of cabinets in Japan in the past have been quite consistent in trying to apply this notion of human security. And what is interesting is that, particularly during the Mori cabinet, 2000 Millennium Summit, even Millennium Summit was held during the Mori cabinet in Japan. And in Okinawa, Japan hosted the G8 summit back in 2000. This was just an accident, but this was a lucky accident. Health is at the core of human security, and Okinawa Communicable Diseases Initiative was proposed, and $3 billion was committed by Japan. And this was quite had a synergy with MDG number 6, communicable diseases. And as a result, AIDS, tuberculosis, malaria, a global fund was established. So this was a success by the Japanese government's initiative. So we have a set of global goals, and through working with other G7 countries, Japan was able to exhibit strong leadership in effective fashion in producing results. And again, now that immediately after the adoption of the SDG, the first G7 summit after the adoption of the SDG will be held in Ise-Shima, and Japan will serve as the chair. This is also somewhat accidental, but we need to turn this accident into a positive. We need to ensure synergy so that we can build, make a first step towards building a new order for both human and earth. From the perspective of human security, let me share with you my thoughts. It all started with the Obuchi cabinet. I think it was either in 94 95, Human Development Report was issued, and for the first time, UNDP proposed the notion of human security. Obuchi cabinet, we were faced with declining the number of those in Japan who had experienced war, and future-oriented pacifism was something that we had to build. And human security was quite befitted for the Japanese government's policies. And this policy, it has been carried forward by the succeeding cabinets. During the Mori cabinet, a fund for human security was established within the UN at the same time. UNDP human security notion was still very much focused on individuals and was multidisciplinary, and multilateral measures to protect the human security of individuals were there, but it was still in the early stages. Therefore, we've closely worked with Kofi Annan to establish Human Security Commission, CHS, within UN. And Amartya Sen, the first Asian to win the Nobel Economic Prize, and Madame Sadako Ogata became co-chairs to deepen the discussion on the notion, and their discussion was presented to the UN, and UN's General Assembly adopted human security in an official fashion. And this has been carried forward by ensuing Japanese cabinets. During the Fukuda cabinet, it just so happened that Toyako Hokkaido G8 Summit was held. And during Toyako G8 Summit, Japan gave a particular focus on enhancing health and health systems. And G8 Summit actually had a significant discussion on health and health systems. And what motivated Prime Minister Yasuo Fukuda was that basic challenge related to human security. He decided he chose human security, health as a core, at the core of human security. So human security, importance of health in human security has taken significant root in the policy discourse in Japan, in a series of cabinets in Japan. Now, speaking of the notion of human security, through the discussion at the Human Security Commission, it was a major departure from UNDP's notion. Developing countries' leaders were dubious about the true motive of the advanced countries, and therefore the notion of human security is not mutually exclusive with national security, and to address common challenges, cross-border transboundary common challenges, national security may not suffice. Therefore, or the human security will be used as a supplement to national security. So we've tried to convince the developing countries that human security is not to exclude national security, and there was a focus on three universal freedoms: freedom from want, freedom from fear, and freedom to live in dignity. And as a basic unit for policy making, they decided to target people and community as unit of policy making, and the policy framework was redesigned to enlist the support of developing countries. And as a result of this discussion, health was identified as a vital core of human security. Why is it that health is a vital core in human security? As I said, the community was identified as a basic unit, and we are to focus on the safety of people living in communities. In that regard, there are two categories. One is top-down, and the second is bottom-up categories. For the top-down category, we have human protection. For example, a government will establish police, law enforcement, and protecting the social order is a form of human protection. Fire departments to address disasters is a part of top-down policy decisions for human protection. The other category is bottom-up human empowerment. This encompasses education, vocational training, to say the more different opportunities for business opportunities. These are in the category of human empowerment. So the policies in diverse areas could all contribute in achieving human security. So these policies have been integrated in the notion of human security so that each one can enjoy more options to spend meaningful lives. And by increasing the options for meaningful lives, this should be deemed as expanded freedom for all. That is the basic notion of human security. And this was established by Amartya Sen. And policy decision in implementing this, we are to focus on the communities to implement and combine human empowerment and human protection. And this is a notion to integrate different policies, and this was done thanks to Madame Sadako Ogata. And this is the path that we have followed to form the human security notion as we see it now. During the process of developing the human security notion, and the outcome of the SDG discussion are very much similar to each other, which is quite a surprise. In that regard, yet another point I would like to share with you that Iseshima Summit, during the Iseshima Summit, what will be the leadership that Japan will play in discussing the issues related to health? As I said, there are two categories, human empowerment and human protection. From these vantage points, in order to ensure more options for individuals to live more meaningful lives, how to position the issue of health is the question. Health only will not result in increasing options for meaningful lives, but if you lose health, if you want to increase options, other options, health could be a serious impediment in trying to increase other options. In that regard, when we try to make available options. Health is at the very core, and that is how health is positioned in human security. Therefore, the importance of health has been widely recognized. Having said that, Japan, since 2008 G8 summit, we have been promoting this idea: polio eradication, HIV, stop TB, malaria. We still have vertical approaches, disease-specific approaches that used to be the trend in health policies, but that alone would not suffice in achieving goals. Therefore, we need a horizontal approach and a resilience of healthcare system. A horizontal approach to ensure resilience of health system is needed. Having both as factors, effective policy decisions for global health can be achieved. That is something that Japan proposed during the 2008 Hokkaido Toyako Summit. And through the approach of making resilient health system as a goal, universal health coverage, according to WHO's definition, all the people at affordable cost, appropriate health services, including prevention, can be accessed. That is the definition by WHO. And through resilient health system, achieving universal health coverage has been what Japan has been trying to help around the world based on the experiences of Japan, because in health and medical service areas, there is a clear comparative advantage. The life expectancy for both male and female is one of the top in Japan, in the world, and healthy, lively lifespan, number one. And already in 1961, national income used to be $4,120, but back then we already established a universal health insurance, and it's been more than 50 years since we've enshrined universal health coverage in Japan, and we have been trying to work on the sustainability of universal health insurance, universal health coverage. So we have an ample experience in Japan. So in order to achieve SDGs, there are some of the Japanese strength, and it is through the Japanese strength that we as a nation can contribute in achieving SDGs. And I think all countries need to focus on their strength in contributing to achieving SDGs. And for human security, health is at the core of human security, and health is one of the areas where Japan has a particular strength. And that is why Japan is committed to promote UHC based on our experience in health. And that, I believe, is the approach Japan should take in presiding over Iseshima Summit this year. And this is exactly what Prime Minister Abe has clearly stated in the Lancet, which is a medical journal, British medical journal. And active contribution to peace. Under active contribution to peace, health will be addressed. Health, which has become a global challenge, will be addressed, he clearly said. In order to, by resolving common challenges, Japan will contribute in building a foundation for peace. So the basic philosophy in addressing health challenges is the human security, notion of human security. And while contributing to health society, Japan is committed to build a more peaceful world. And this will be the basis of Iseshima Summit, which will be held in May this year. And particular focus will be given on how universal health coverage can be achieved. And this will obviously be one of the agenda items during Iseshima. And SDG number 3, it talks about communicable diseases and other risks, and the international community, particularly low-income countries, how to make them able to respond to these risks is a part of this goal, and this will be treated as a major theme. Ebola, hemorrhage, fever outbreak, and other outbreaks will have to be addressed effectively, and specific concrete policy proposals will be made during Ise-Shima summit, and on the 16th of December, a conference to prepare for that was held. This is aiming at producing synergy effect with SDG 3, and we need to be inclusive. You have to encompass all relevant policies, and that was what we did discuss during this conference. One of the salient characteristics of this conference is that they focus much on public-private partnership, and even in the public sector, it was not just the Ministry of Health, Labor and Welfare. Health could be a diplomatic challenge, therefore, needless to say, a Ministry of Foreign Affairs was a part of this, and World Bank is under the auspices of the Ministry of Finance. Therefore, Ministry of Finance was also one of the organizers, and JICA was one of the organizers, and civil society. I serve as the senior fellow of ICE, JCIE, and I'm also a member of the board of JCIE, and JCIE representing the civil society, or the NGO, was a part of the organizers group. So as Professor Kanye mentioned, in order to resolve each of the SDGs, there is a need for integrated approach. We need to collaborate all different actors and policies. That will be a key in achieving SDGs, and that is what we are already practicing in addressing health-related SDGs, and 300 leaders come together to have a deep discussion on issues related to health. So we have seen much progress in preparing for Ise-Shima Summit. So we have seen transformation from MDGs and SDGs, and what are some of the differences between MDGs and SDGs in the field of health? Maternal health, child health, communicable diseases. In the past, we've used to take vertical approaches, disease-specific approaches. We are now looking at health from a more comprehensive fashion, from social implication, including social implications, and not just from health perspectives. We are to look at human well-being. People should be able to enjoy well-being, and these targets were established by taking into consideration well-being aspect as well. One of that is one of the things that makes SDGs different from MDGs. Speaking from the past experiences, the approach may not have been effective in trying to improve the health of everybody. Therefore, we are to ensure healthy lives and promote well-being for all at all ages, and this is underpinned by the notion of fairness and equity. And a resilient health system approach was added, and universal health coverage is one of the tools to achieve resilient health system approach. Universal health coverage is positioned as the core notion, and no one left behind in SDGs is reflected on this particular point. Also, thirdly, for the past strokes, cancer, and diabetes, non-communicable diseases have resulted in a significant rise in the number of mortalities. 80% of those dying from diabetes are those in developing countries. Therefore, measures for chronic diseases will have to be implemented through resilient health systems so that necessary medical services will be provided on a sustainable basis. This will be critically important. So within SDG 3 health goals, there are 3 targets. These are the 3 targets under SDG 3. And the theme is encompassing, ensure healthy lives and promote healthy lives for all at all ages. It's not just about health, but healthy lives. And SDG also tries to promote well-being for people at all ages. Without doubt, we will be focusing not only on living longer, but living better. I will be focusing more on health life expectancy, and this suggests that there will be a significant paradigm shift. Live longer. We are transforming from a world of live longer to the world of live better. This is very transformative. And universal health coverage is enshrined in Goal 3, SDG 3, finance and workforce are the building blocks of a health system, and these two building blocks were recognized as important. And at the time of SDGs, we had Ebola outbreak. We were faced with outbreak, and leaders realized the importance of addressing communicable diseases, and that is why we have 3D. Strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. And they again focus on community level measures. We have 3D because the world was faced with the outbreak of Ebola back then. And through these three targets, the comprehensive policy decisions will be made on different levels to bring about resilience in health systems. In that regard, Ebola hemorrhage fever had a significant impact on us putting together SDGs, as exemplified by Target 3D. And it was also a following wind in trying to carry forward the notion of human security. In reality, there was a mounting criticism that WTO's response was delayed, and global governance. This criticism led to our discussion on better governance. And it was again realized that it was very important, particularly in the least developed countries, low-income countries, to bring about a resilient health system. And there is currently shared understanding that there is a limit to current health policies. For example, at funerals in some countries, they cleanse with water corpse, and they hug or embrace corpse. And those are the locations where infection of Ebola hemorrhage fever will spread. And it was through funerals that this disease spread. And there is obviously a limit as to health policies. And there is this divide between central government and the local government, and with the communities, local communities, because many of these companies are young, out of civil wars. There is no political trust and confidence in governments. Therefore, in such countries, even if the government is trying to change the practice through education and training, the people in the community are not receptive. Therefore, on community levels, we need to mobilize different policies only through which we can resolve health challenges. And this was one of the very important lessons that we have learned from the outbreak of Ebola, which means that there is a need for integrating policies on a community level in protecting human security of individuals. This is exactly what Japan has been advocating in trying to in promoting the notion of human security. So what I would like to say in conclusion is that SDG is macro global, and during the process of putting together this macro global goals such as SDGs, one challenge are integrated with other challenges. Therefore, since the challenges are intertwined, we need a mix of policies in an integrated fashion. And this exactly is what we have been demonstrating by emphasizing the importance of human security. And even on the micro level, on a community level, such as outbreak of Ebola, we need to combine macro and micro initiative and policies in addressing health and medical challenges, SDGs, and Ebola. Although they have yet to resort to the notion of human security in a way, in terms of the way of thinking, what we have learned from the outbreak of Ebola and our experience in putting together SDGs is a sign that there is a growing understanding amongst the people around the world on the importance of approaches that are very much akin to the approaches that Japan has been proposing under the notion of human security. And this could contribute in resolving global challenges. And through addressing global challenges, we will be able to make a contribution to the designing of new orders, and that will help in implementing proactive contribution to peace, which has been championed by Prime Minister Abe. I've rattled through, but because of time constraint, with that, I would like to conclude my report. Thank you very much for your attention.